Thank you to the many organizers of this conference for inviting me to speak to you today. I have the distinct pleasure of speaking to you from the beautiful island of Maui. We're going to chat about cardiovascular health and how it impacts communities. And since this conference is uniquely Canadian, I've spent a little bit of time including figures from the Canadian Public Health Network to better illustrate my points. So with that brief introduction out of the way, let's move on to the rest of the talk. So I'm going to start with this slide. It's a little busy, but if you look carefully on the x-axis, we have progression of time over 80 years from 1934 to 2014. And in that short arc of history, there's been a tremendous explosion in what we know about cardiovascular health. Above the baseline, there are various and successive studies looking at diverse populations from around the world. And below the axis are identified risk factors that resulted from this research. So for example, in the 50s, we came to know about the negative effects of tobacco use and uncontrolled blood pressure, as well as cholesterol. In the 1970s, we came to know about HDL cholesterol and its protective effects, as well as diabetes and its effects on the heart. And in the 80s and 90s, we found out about inflammatory markers and subcomponents of cholesterol that are now targets for future therapies. So if we look at health from a multidimensional perspective, research tells us a bigger story, one that travels along one's life. So from our genetic makeup and experience in the womb to the environment and socioeconomic class in which we're raised, along with behavioral factors, so individual behaviors and modifiable risk factors, those would lead to potentially stroke, heart failure, heart attacks, and other cardiovascular conditions. So if it isn't obvious, cardiovascular disease is a pretty big deal. So how big? Well, in Canada, it's the second leading cause of death, only after cancer, based on 2018 data. And a lot of patients suffer from some sort of heart disease. With regards to heart failure, there are about 600,000 patients in Canada alone, and that's based on 2015 data, so it's probably more now. And these diagnoses add substantial cost, with about $10,000 being the average cost for either a cardiac bypass surgery or heart failure hospitalizations. So it's also a disease that disproportionately affects the elderly. So while in Canada's aging as a whole, it's most pronounced in the Canadian Atlantic, which includes Nova Scotia. As noted in the light blue section of these bars, the elderly in Canada also spend more time in the hospital as part of their, so sorry about that. So I'm just having some issues with my slides. Sorry about that. So as noted with the light blue section of these bars, the elderly in Canada also spend more time in the hospital as part of overall care as compared to younger ages. And the proportion of overall healthcare costs that come from the hospital setting are a dominant portion of overall healthcare spending per capita, with Nova Scotia the second highest in all of Canada. And when you look at the population of Nova Scotia, the burden of disease is higher. An expert from Dalhousie comments that compared to the rest of Canada, Nova Scotia has a higher proportion of smokers, obese patients, and patients who are sick going into heart surgery. So for the rest of Canada, it's about 30%, but for patients in Halifax, that's about 60%. And all that baseline complexity of care has impact on finances, both in Canada and in the province. So on the left, we can see that Nova Scotia spends the third highest amount healthcare in all of Canada. On the right, there's a projected and widening gap between revenues and expenses. And I would say that's pretty bad. So if we were to bring this back to the overall theme of this talk and this conference, what are the biggest challenges we face from a city planning perspective, which certainly includes individual health in addition to public health? Some big areas of focus are pollution, which include air, ground, noise effects, excessive ambient heat, which is becoming more common to see in global news reporting, lifestyle choices such as smoking, inactivity, and chronic medical conditions, as we discussed earlier. Interestingly, while air pollution makes a lot of news these days, particulate air pollution seems to be more of a crisis in the areas shaded in red, which include Northern Africa, the Middle East, parts of the Indian subcontinent, and China. Notably in Nova Scotia, which is pretty dark blue, there appears to be less of a problem with this kind of pollution. However, we should definitely worry about obesity. Focusing in on North America, in the US, as shown in the maps above, we can see almost a perfect overlay between areas with high obesity and areas with high cardiovascular death, That's based on CDC data. And in the Atlantic Canada, as depicted in the graphs below, on the left, you can see Nova Scotia has some of the highest obesity rates in all of Canada. And on the right, we can see low rates of activity were certainly associated with a jump in cardiovascular rates as compared to moderate and high activity individuals in Nova Scotia and throughout the Canadian provinces. This slide is there to illustrate how even Canada is not immune from increasing global temperatures and how this might pose a threat to human life as this continues to worsen over the course of the century. And we don't often think of noise as a health risk, but surprisingly, it's quite a major contributor to cardiovascular health. This figure comes from the Canadian Journal of Cardiology and demonstrates that ambient noise underlies a clear increase in stroke and coronary artery disease. And this is based on prior studies. Interestingly, much of this noise comes from the transportation industry, especially road vehicles. And based on earlier slides, it shouldn't come as any surprise that Nova Scotia ranks second highest in Canada for diabetes incidence and third highest for hypertension or high blood pressure. Tobacco dependence remains a significant public health issue. Though these numbers are a little out of date now, gains in smoking cessation have plateaued in most places. And smoking has been supplanted, unfortunately, by a rise in vaping, disproportionately and worryingly affecting youths 15 to 24 years old, including in Canada. So how do we bring this important health information to bear on city planning? A big push has been made to address these problems holistically, and we can map out our proposed solutions and see how everything connects together. In this flowchart, as you can see, various issues can be addressed with innovative approaches. For example, heat can be addressed by designing cities to limit heat islands. Obesity can be addressed with clinics that target this issue. Good example of this was a clinic that was recently unveiled by the government of Nova Scotia and Cape Breton last year. Noise can be addressed with transitioning combustion engines to electric power, diabetes with continuous glucose monitors at home, high blood pressures with direct outreach from pharmacists, tobacco with smoke-free areas in public places, and vaping with legislation that restricts the use of flavored e-cigarettes that target children and young adults, as was done in Nova Scotia in 2020. So as you can imagine, a top-down or top-to-bottom approach to these issues can be quite effective if implemented successfully. Sorry about that. Many of these ideas are being worked on in Canada, even here in the United States, and we are really at the early innings of a revolution in how we view health and the communities we live in.